If you're over the age of 65 and currently enrolled in Medicare, or maybe interested in enrolling in Medicare if you just retired, we have the information that you need because it is almost open enrollment time, which can be a little scary, but here to help us out and not be too scared is Joel. Thanks for joining us.
Thank you. It's a pleasure to be here.
All right, so you're with Affordable Medicare Plans.
That's
so go
correct.
ahead and give us the backstory on your company.
Well, I've been helping folks locally here for 37 years with their Medicare coverage. We're an independent company that represents for various insurance companies and all their different plans. And in the annual enrollment here, which goes from October 15th to December 7th, people have a chance to look at their coverage, do a review, and see if there's something that's actually better for them. And so we sit down with them, and there's no fee for our services. We give them an unbiased opinion as far as all the different carriers and how they work and what can be beneficial to some and versus others and so forth, and just help them sift their way through it. We're local, though. We're not an 800 number.
And do you work for the Medicare companies, for the government, or how does that work?
Well, we don't work for Medicare. We work for the insurance companies. Medicare has it to where Medicare pays us a fee through the insurance carriers as we help them with their insurance plans. So we get a fee for assisting people. It's a fee that does not cost them anything. It's a fee that does not raise their rates, but they get our service at no cost.
All right, and at no cost, that's the important thing. You can help us
Yes.
figure out. So let's break it down to basics, and let's start with when do people enroll in Medicare, and who are we talking about?
Well, people can obtain Medicare under 65 by disability after 2 years that they've been on disability. Typically, they enroll at age 65 when they, become eligible at that point. Some folks wait until they, come off their group health plan to get Medicare. But there's a variety of times. Many times we meet with folks, 3 to 6 months, even 12 months before they become eligible for Medicare, just to give them a ballpark picture of the various plans that are available and what their options are. And then we meet with them again as they get closer, answer further questions, and sometimes even a third or fourth time, just to make sure that they're comfortable with their, with what they want.
So what if someone did not take the Medicare option at age 65? Are they kicked out forever, or can they still enroll?
No, they can enroll. There's certain plans that have very low qualifying for it. They don't have to answer health questions for that. There are other plans that do require that, but it's every year, like for instance, in our area, there's 25 different plans that offer supplemental policies,
Wow.
10 different supplemental policies. And in the Advantage products, there's 18 different choices, and there's 29 choices in drug plans. So people getting stuff in the mail, it's hard for them to understand which plan best suits them based upon their doctors and based upon their prescriptions.
That's a lot of options.
Yes, a lot.
So as we're in, enrollment period, there's a couple different ones. What are we in right now, and what are we able to do?
Well, the annual enrollment, you can look at your supplement plan, and if you've been on a supplement plan for some time, and I say that about 5 years from the time that you signed up at age 65, your rates have gone up, and many times we can help folks save $60, $70 a month by just re-rating them. And on a fixed income, that's a sizable amount there.
Absolutely.
The drug plans will change every year, so as people change their drugs, they need to look at these plans and be able to determine which plan best suits them relating to that. The Advantage plans, they change also. They compete with each other. They add new benefits every year. So people that are just saying, I've got my coverage, I'm happy with it, but don't take a chance to look at it, they could be missing out for some better benefits.
Better benefits, better savings as well.
Yes, yeah.
So what are some key things that we need to keep in mind as we approach you to help sift through all these different options?
Well, first of all, think that there's no charge for our services. I helped an attorney recently, and he said, I spent 30 hours looking at this. He said, I'm so confused. He said, I don't believe you're going to explain this to me in an hour and a half. And I did. I explained it to him in an hour, 30 minutes answering his questions, and I asked him afterwards, could you explain this now to your friends? And he said, yes.
Perfect.
And his question to me was, why doesn't everybody use you? And I told him, I said, well, a lot of folks just don't know about us.
Yeah.
But there's no pressure to enroll. We help folks sincerely look at their options, their choices, their current coverage, and then we give them the ability to understand.
And if someone's still working, you can help them decide if it's better to stick with the group plan or not as well.
Yes, that's a big thing. Many times we can reduce their cost, increase their benefits, and people think their group coverage is better, and many times that's not the case.
All right, how do we get in touch with you?
Well, we've got our phone number there. It's 771-9524, or the one that comes up on the screen. You can call us there, and we'll be glad to schedule you an appointment. We're in the shopping center of Hobby Lobby in Hickson, and we'll be there till December 7th.
All right, thanks so much.
Thank you.
Are you turning 65 and confused about A, B, C, and D and all the various senior plans? Even if you're still working, there may be better choices than your costly group health plan.
Call us. We're local with answers to help you